Greetings, everyone. My name is Peter Young. I'm on the board of Societe de Chimie Industrielle, and I'm head of programs. And I'm very pleased to be the introducer today of David Cole, the president and CEO of the Science History Institute, and on a very important and interesting topic. Before I introduce David, though, I just want to briefly comment about Societe de Chimie Industrielle and upcoming events. First of all, it is a 103-year-old nonprofit that was established many years ago with a focus on various activities, education, and helping people in the industry in chimie, which in French covers both chemicals and pharmaceuticals. So that's been the emphasis. We have a wide variety of in-person, and webcast events, educational events and speeches like this one through the year. Fewer in person the last 2 years, but we hope to restart in-person meetings later this year. We have scholarships that we give for research for students, undergraduate and graduates studying chemistry or biotech. We have mentor programs, and we have an ESG effort where we help educate the industry on what's happening in ESG and the impact on companies and individuals. And we also have the International Palladium Medal Award dinner, which is normally every 2 years to recognize someone who's really contributed significantly along the lines of the mission of the organization. I'm very proud to have been on the board since 1990. We have two events that I just want to mention before I introduce David. One is on April 20th. We have a very exciting webcast on the whole development and innovation in coatings. And we have senior executives from 4 coatings companies that will really engage in discussion of these issues. And it'll be at 1 o'clock on April 20th. On May 4th at noon, we're going to have a webcast and panel on lithium. What's the supply and demand situation? What's the impact of electronic vehicles, et cetera. So we'll have some industry experts and some journalists who are going to be on that panel. So we look forward to having you join those if you're interested in those topics. The topic today, I think, is very, very important because although vaccines was kind of a sleepy topic for a long, long time, and pharmaceutical companies lost a lot of interest in vaccines, it has really been a headline topic for the last 2 years. And I don't have to tell anyone here that the success of the pharmaceutical industry to develop COVID-19 vaccines really pretty extraordinary. And how quickly they were able to do that. Today, speaker, David Cole, as the president and CEO of the Science History Institute, is going to be able to comment on vaccines in a very interesting way. He is the head of the Science History Institute, which many of you know also was once called the Chemical Heritage Foundation, that's based in Philadelphia. And it is a highly respected organization that has a variety of functions. They have a museum, they archive and store important historical documents related to inventions in the sciences and materials, and they also collect oral histories. They have a variety of activities that are very, very, really excellent, and they also have a life science oriented location on the West Coast. David became president a couple of years ago. Prior to that, he was the executive director of the Hagley Museum and Library in Wilmington, Delaware. And before that, he had a number of positions, for example, as the vice president of the Whitehead Institute for Biomedical Research in Cambridge, Massachusetts. He has degrees from a lot of prestigious schools and a PhD, so I guess we can call him doctor. And I had the privilege of being on the board of the Science History Institute for a number of years. And it's really pretty extraordinary what they do, but also the kinds of changes that David has instituted since he's become president. So with that, I do want to turn it over to David, but with one comment, which is David is going to give a speech with some slides. It's going to be about 35, 40 minutes. And then we plan to use the last 10 or 15 minutes at the end to answer questions from the audience. With the setup that we have here, the way you ask questions is just open up the chat box and type in your question, and we'll be able to see the question, and we'll answer as many as we can. But you don't have to wait till the end of his speech to type in your question. It'd be actually nice if you type them in so we have an idea of how many questions and what the topics are before he ends his speech. So with that, I'm going to turn it over to David, and so he can talk to you about a very, very important topic.
Very good. Well, Peter, thank you very much. Very good to be with you all. I'm reminded of the fact that Societe for many, many years has been one of the affiliate institutions of Science History Institute. So thank you for that. I am among friends and peers today. Very exciting. And I'm here to talk about a topic that has certainly been on all of our minds, as Peter was saying, for a very long time, at least 2 years, right, if not longer, vaccines and vaccination. But from a very Science History Institute perspective, from an historical perspective, I'm interested in the question, what can we learn from the past, the history of vaccines, that might help us make some progress and think about positive steps forward on the vaccine frontier in the future? Certainly, we don't need much reminding that this is a very heady time to be involved in research on, or the manufacture of, or the distribution of vaccines if you are in that line of work. It has been said in more than one place recently that we're really living in the age of the vaccine. It has been stated that no technological innovation other than making clean water available has had more influence on saving lives in the history of this planet than vaccine development. And here are just a few statistics to remind us of that fact. This has been indeed particularly a vaccine century. No cases of polio. I would amend that to say almost no cases of polio have been identified as originating in the US since '79. Measles vaccinations have helped eliminate 99% of cases in the US. And smallpox has been eradicated or nearly eradicated all around the world. These are just some of the successes. And there's a lot more to come. So with all the new technologies that are coming on board, mRNA and otherwise, there are all kinds of plans being put to work, put into practice at universities and other academic settings, in companies, startups that are focused on all kinds of opportunities to which we can apply vaccine technology. And so from that standpoint, the future looks very bright. There are oceans of money going into this space, particularly from the private sector. But I want to raise a couple of cautionary notes here. I was with my friend Bob Langer just about a week ago. Bob was giving a talk in Florida on his latest work with the mRNA technology that has enabled the Moderna vaccine. I think most of you are familiar with that. Bob has probably done more to enable that technology than any other scientist alive. And he's very optimistic about the future of vaccine technologies in general. But he had a couple of cautionary things to say in his remarks last week. And the first is that, yes, there's a lot of money available, capital available to go into new investment in vaccine technologies. But a lot of that money is what we might call a little shy. It's a little risk shy. A lot of the companies that have money to put into vaccines historically haven't seen great payoffs in that space. And even though opportunities look better going forward, there's some hesitation. And there's also a concern on Bob's part about the public's attitude toward vaccination. We know that the majority of people in this country, for example, have bought into the latest COVID vaccines, are using the vaccines, but there's still a stubborn minority that isn't sold. And increasingly, there's a lobby that's raising issues around the vaccines. And Bob sees this problem manifesting in a couple of ways. First is that without public support, he sees us on a continuing downward trend with respect to public funding for the kind of research that is funded through traditional federal sources like the NSF or the NIH. And this is a graph that shows you the problem that we've had in recent years that hasn't been arrested yet. And that is that after a big launch for federal funding for basic scientific research, basic health research in the 60s and accelerating through the 70s and 80s and 90s, in the last 20 years or so, in real terms, we've actually seen a decrease in the amount of money going into the kind of basic research that it takes, for example, to develop mRNA technologies, a decrease in that level of dollar input from the federal government. So increasingly, the federal government is seeing we're seeing waning support from the federal government, and this is in part a reflection of ambivalence on the part of a public that's not really pressuring its politicians to fund basic scientific research the way that they used to. And Bob sees this as a long-term problem for funding the kind of basic research that really drives a lot of the innovation that eventually turns into translational opportunities. And then there's this related issue that I was mentioning, that there is still so much vaxism, skepticism that feeds into the federal funding problem, the political problem, but also perhaps puts a bit of a lid on the eventual market for a lot of these vaccines. Scientists can develop the ideas, we can find funding, take things to market, but if there's a significant segment of the population that is unwilling, then we're not going to be able to fully exploit the opportunities for vaccines that we see in front of us. And you can see here a graph from The Economist showing that just as of last year, the United States, second only to Russia among major nations, expressing vaccine skepticism. So there are a couple of sort of major macro headwinds facing us, and they both relate to our need to really change public perceptions around vaccines and how they're useful, how they can be efficacious, an excellent investment and key to future public health benefits. So I work for the Science History Institute. As Peter said, we are a collection of historians, curators, researchers. We focus on the history of the chemical and the life sciences. And we have questions about all this. And we wonder, as historians, how can we contribute to addressing this issue? The fact that in spite of this sort of paradox, that in spite of the fact that vaccines represent more promise today, perhaps, than they ever have, there's potentially more benefit to be derived from vaccines than ever before going forward. We're at a place where the public really has a posture almost of ignorance in many cases with respect to the potential of vaccines. They don't really understand the issues. And the public is being told to, quote unquote, follow the science. But if the public really isn't in a position to follow the science because they don't know enough about the basic science, or they don't really have a way in, they don't have a way to engage with the science, something to bring them into the conversation that makes it engaging and enticing, then it stands to reason that we're going to lose a lot of potential audience for the conversation around vaccines going forward. So my institute and other historians are very much focused on how can we deploy the history of science? How can we deploy the history of vaccines, tell stories around the history of vaccines and vaccination, and use those stories to engage the public in ways that perhaps they wouldn't otherwise be engaged in this one of the great scientific questions and opportunities of our time. So I want to talk a little bit about what the history of vaccination has looked like in the past, what there has been of it, and certainly what the public has really appreciated of that history, and then say a little bit about ways that we might tell that history a little differently going forward, lessons we might derive from it, and how we can impart those lessons to the public in ways that make the history very engaging and accessible. So if you're like most, I think, well-read lay people, we'll call it, your familiarity with the history of vaccines probably revolves around a handful of so-called great men in history. A handful, really, because we're talking about people like Dr. Edward Jenner, who in 1796, as you probably know, is credited with coming up with the first smallpox vaccine using cowpox. And I'm showing you the kind of heroic image that is typical of the way that we frame and treat Dr. Jenner historically. Here he is doing the first inoculation of 8-year-old James Phipps in 1796. And again, Jenner is presented as one of the great iconic heroes. And the history goes on from there, almost as if a baton is being passed from Dr. Jenner to Dr. Pasteur. And Pasteur is presented typically as the person who takes up the vaccine baton from Jenner after almost a century and develops other vaccines, anthrax, rabies, and so on, for a broader public, and really popularizes vaccine platforms as something that the public is aware of, understands the benefit of. And then from there, we pass over a lot of other major scientific, technological contributors until we get to the other more or less familiar name, and that is Jonas Salk. So now we're up to the mid-20th century. And this triumvirate, really, of Jenner, Pasteur, and Salk is what registers for most people when they think about the history of vaccines. And it doesn't really typically go much further than that. Certainly in schools, it's rare to find the history of vaccination treated as a topic where any but these three figures are discussed. So that's a problem, because it robs us of some of the richness of the history that we can use to impart important lessons about what vaccines have been and what they could be going forward. And one of those lessons is that vaccines, the origins of vaccines, really take us to places outside of Europe and the United States and broaden the conversation geographically about where vaccines come from, where these innovations were originally rooted. I'm showing you here an image of what was called Insufflation, a practice that was deployed by the Chinese, we believe, as early as 1,000 years ago, around 1000 CE. And it was a technique whereby pus taken from a dried smallpox lesion would be ground up and powdered and then literally blown into the nostrils of someone who they wished to immunize. And this is a technique that was not known in Europe until around 1700, but was practiced in China, as I said, from at least 1000 CE, and quickly spread to Africa and the Near East well before it came to Europe. So again, another one of the stories about a technology that makes its way to the West very much along the Silk Road route. So this is a story that I think is the kind of thing that would surprise a lot of people who assume that vaccine technology has been, from its beginnings, the province of the West. And of course, it's simply not so. And that story takes us to Turkey in the early 1700s, the Ottoman Empire to be precise. And in the Ottoman Empire, they've taken the technology there, and in Africa and other parts of the Near East, they've taken the technology a step further. And they have inaugurated the use of a technology called variolation. So in variolation, what you do is you take pus from a suppurating lesion, and you take a lancet and you make a small incision in the arm of the person that you wish to immunize, and you scrape some of that pus into it, either live or dead, and meaning the toxin is either alive or dead, and then wait some time and isolate that person, and then eventually that person develops resistance to smallpox. And in most cases, this is an effective cure. People who were not immunized this way, if you were infected with smallpox, in about 20 to 30% of cases, you were going to die. After the introduction of variolation, the rate of mortality went down to more like 1 to 2%. So this was an enormously successful technique. And it did not escape the notice of this person. This is Lady Montagu, I'm showing on your right. Lady Montagu was the wife of the British ambassador to the Ottoman Empire, and Lady Montagu noticed this technique was in use and was interested in using it for her children. Her own physician, Dr. Maitland, was not in favor of using the technique. He felt that he would be made ridiculous, that it wasn't a proven technique. He would rather stick to tried and true methods. But Lady Montagu persisted and eventually wrote up, with the help of some other physicians, wrote up the technique, and it was presented in London at the Royal Society in 1721. And variolation was adopted by many of the people who learned of the technique through these meetings. And it became something of a success story, and rates of infection and death began to go down in England as a consequence. This is where the story really gets interesting, because there's a transatlantic dimension to it. And the transatlantic dimension is that also in the same year, 1721, aware of the discussion that's taking place in London, physicians and other leading lights in Boston decide that they want to think about variolation as a way to address a smallpox epidemic that is blooming in the Boston of 1721. In a town of 11,000 people, we believe in Boston, 1721, we believe that almost 6,000 were infected at one point or another with smallpox, a terrible outbreak. And Cotton Mather, of all people, the Puritan Cotton Mather, is actually at the forefront of scientific thinking about the problem. And he comes across an inspiration for how to deal with the problem through an engagement with an enslaved person who was actually, this was a man named Onesimus, who was actually Cotton Mather's slave. And Onesimus had come over from Africa a few years before. And Onesimus had brought with him a story that he had been inoculated, and showed Cotton Mather the scar where the variolation process had been used, and said that this had been enormously successful in the part of West Africa where he'd come from. And Cotton Mather is excited by this news and begins to share it out, and tries to convince a number of citizens in Boston, physicians in Boston, that this is a technique that they really should be looking at to address this horrible outbreak in their community. Most of the physicians, again, weren't interested, turned him down, said this won't work, it's risky, perhaps it's not safe. But one physician took him up on the proposition, and that was Zabdiel Boylston, who you see here, of Boylston Street today in Boston. And he was willing to try the variolation technique, and it was applied with great success. So much so that again, the rate of infection and the mortality rate went down significantly in Boston after its application. And Zabdiel Boylston wrote up his findings in his own account of what happened in Boston and transmitted those findings to Britain, and thus began a century-long or more transatlantic correspondence about the possibilities of variolation as a way to deal with smallpox. And so a great success story that, again, spans multiple continents, multiple actors, not just the traditional actors that we're used to associating with vaccine innovation. And to expand the pool of actors a bit further, The next step in the history, or for many people, the first step is the innovations of Dr. Jenner, 1796 in England. But as we know now, the story doesn't really begin with Dr. Jenner. Like so many good stories around innovation and the development of new technologies, it's actually a group effort. And there were many, many players involved who typically don't get a lot of credit. And I'm showing you now a portrait of a man named Benjamin Jesty. Benjamin Jesty was a yeoman farmer in England, active in the second half of the 18th century. And well before Dr. Jenner's celebrated experiments of 1796, Benjamin Jesty noticed on his farm in the 1770s that young women, in particular young women, milkmaids, if you would, who were working with cows often came down, contracted cow pox, and they would end up with lesions on their hands and on their forearms. And what he noticed was that these milkmaids, these dairy workers, were basically never coming down with smallpox. They'd be exposed to it, but typically they wouldn't contract it. And they were very proud of this fact, talking about how they would always have nice complexions because they were never going to be afflicted with smallpox because they worked with cows. And so Jesty thought this was curious. He wasn't a man of medicine. He wasn't a scientist, but he decided to explore this further. And so he took some of the cowpox and through the variolation technique, using a lancet, applied it to members of his own family, his wife, his son. And then after a period of time, noted that during a rampant outbreak of smallpox, they weren't getting smallpox. Nobody in the family was contracting smallpox. And he concluded that there was a connection here. And he wasn't the only one. Other people in the connection in this community concluded there was a connection there. But the findings were never written up in a serious way in any major scientific publications, nor were they presented to scientific bodies. And so the insight was left there, although Dr. Jenner was aware of Benjamin Jesty's experiments as early as the 1770s when they were taking place. So later, by 1796, when Edward Jenner is making his groundbreaking experiments with using cowpox to inoculate people against smallpox, he's already well aware of the contribution of a Dr. Jesty. This idea is already very much in the air. It was in many ways a collective enterprise, a collective investigation and set of findings. And so while Jenner is noted as the person who writes up his findings and shares them out and also designs serious clinical trials to affirm the use of the efficacy and the safety of the new smallpox vaccine, he's really not the person that we can credit with being its originator. The credit has to be distributed. And I think this is a key part of the story, that again, so much innovation is the product of multiple actors, not just one, and often comes from unexpected sources. An important point, I think, for the public to understand. So Dr. Jenner shares out his investigations across England, across Europe, becomes a celebrity for doing so, and rightly so. And the new smallpox inoculation technique is taken up across Europe and with great success. And we get to the next part of our story where we see a distributed, or rather a collaborative effort that hasn't been acknowledged by history. So fast forward now about 80 years, vaccine techniques are now taken up and expanded and further enhanced by Louis Pasteur in his laboratory in Paris. And he begins to go to work on a vaccine for rabies. And in his work, he's assisted by a young assistant named Emile Roux. And he and Emile Roux develop an idea that the way to handle rabies is to extract toxin from rabid dogs and then pass it through various animal models, such as rabbits, thereby attenuating the toxin and making it useful eventually as a vaccine. Well, the problem with this story is that this was another case where someone who should have been credited with innovation wasn't credited with innovation. Mr. Pasteur got all the credit. And after developing the vaccine, the rabies vaccine, and other vaccines, he's much celebrated in the popular press. He's the angel of inoculation. He's the great hero, the great man in the great man theory of history. But the problem with that is that most of the initial experiments along the lines I just sketched out were conducted by this man, Pierre Gaultier, who was a professor in Lyon, a veterinarian, didn't have the political connections of a Pasteur, and as a consequence, didn't get a lot of the credit for Pasteur's work on the rabies vaccine and Emile Roux's work on the vaccine. And yet, in many ways, made the major discoveries that led to their success. So once again, we see a situation where a single person or a couple of people are credited with work, with success that really should have been more widely distributed, and others should have been acknowledged. And a similar situation happens when we get to our hero, Jonas Salk, who is indeed a hero, did remarkable work to bring the polio vaccine to the world in the 1950s. But here again, we know this story. It's told often because we know that he was supported by monies originally set aside by President Roosevelt. President Roosevelt was known for having suffered from polio, so this story got a lot of press, and the connection with Salk was partly cemented in that way. But in fact, what we know is that the polio vaccine success story, again, should be shared with other major actors in the play. Albert Sabin, who came along, actually was developing his own technologies at the same time as Salk, eventually came up with the vaccine in capsule form. And it was the capsule form that actually made the vaccine much more easy to distribute widely, and gain much more acceptance on the part of the public. And so, and yet Sabin's name is not one that we hear much in the literature. So once again, someone who didn't receive full credit for their ideas, but who was instrumental to a long-term public health success. And a final story around success earned, but success not, acknowledgement not necessarily given. And this involves the development of the vaccine combination that eventually became DTP. And this is, I'm showing you now an image of Pearl Kendrick, who was a scientist and worked for the Michigan Department of Public Health in the 1930s and 40s. And she was involved in developing the vaccine for whooping cough. And she did this work with very little resources. She was working for the Michigan Department of Public Health along with her colleagues, Grace Eldering and Lonnie Gordon, who you see here. Grace Eldering is third from the right. Lonnie Gordon is the African-American woman to your left. And all three of them were working in the Michigan Department of Public Health because state departments of health were looking for inexpensive scientific talent to hire. And that meant hiring women who had superb training, but were prepared in those days to have career opportunities to work for a lot less money in the State Department of Health. And it was within the State Department of Health in Grand Rapids, Michigan, that they developed new technologies for culturing and then delivering and scaling up production of vaccine for whooping cough, and eventually for the combined vaccine for diphtheria, whooping cough, and tetanus. Again, they received very little recognition, even though their innovations, particularly of that vaccine, probably contributed to saving more lives than the polio vaccine over the long term. And their interesting twist to their story, their work was made possible by another Roosevelt, not the president, but in this case, Eleanor Roosevelt, who heard about their work to expand production of and enhance efficacy of the diphtheria and the whooping cough vaccine in the 1930s, and managed to wrangle federal funding to support that work. So another story that we're not familiar with, that Eleanor Roosevelt was working behind the scenes in an unofficial capacity, but was able to deliver the goods with respect to much needed federal funding. And so these people should be famous, even though they're not. And part of what we're focused on at the Science History Institute is telling more of the stories of, again, of actors throughout history who've made major contributions to key technologies such as vaccines, who have not received credit. And the goal here, of course, is to encourage people perhaps just entering the field to see themselves in some of these characters, and to think that this kind of investigation and kind of career path is open to them, and also to share the credit more widely, so that people will begin to look for possible solutions and talent in places where they wouldn't have looked otherwise. Very important to our future investigations of vaccines and other technologies. Now, another dimension to the story that we want to tell is about the anti-vaccine movement. I think there's a public misperception today that the anti-vaccine movement is something that's a fairly recent phenomenon. That when we hear the kind of iconic story about one achievement after another chronologically, from a Jenner to a Pasteur to a Salk, we tend to assume that that all along the way, a grateful public bought in, that a grateful public was happy to have these new medical advances, and that the public absolutely was accepting of vaccine technology and went along without any coercion. And in fact, quite the opposite is the case. Anti-vaccine sentiment and even violence is as old as vaccination technology. I'm showing you here a print by the famous English satirist James Gilray in 1802 called the cowpox, and this is his send-up of his take on what he considered to be a scourge of the day, not a health benefit, but a scourge. He's in his print here, he's echoing the belief that the cowpox approach to treating smallpox, pioneered and certainly popularized by Jenner and others, is in fact a dangerous thing, and could cause people to start to exhibit bovine and other animal kinds of characteristics. So here you see examples of cows literally sprouting from people's heads. This is caricature, but it was powerful messaging at that time, and it reflected many of the views of the time that were current. Here's another image, 1800, the same period, same market, image of physicians, Royal Society types feeding young children to the bovine vaccine factory. So another image meant to scare the public into believing that in fact, the new vaccine technologies were really just a way of subverting the body public, and in fact even killing people, and that they were quite dangerous and needed to be avoided. In fact, there's an interesting story about how this applied in France. And so Dr. Jenner becomes very famous, as I mentioned, by around 1800. His work is published, it's shared all over Europe, and a number of other European countries begin to take up the challenge of vaccinating their populations, not least of which was Napoleon. And beginning in 1800 and accelerating through 1813, Napoleon pays, or has the French government pay, for the inoculation of his population, particularly young children up to the age of 14. And this proves enormously successful, but there's also huge resistance to it within France. People are very upset. They're upset because they view it as an unnatural approach. That this is something that, the disease should run its course, or it's in God's hands. They're afraid of what putting animal properties in someone's body might do to the human body. a view that was, again, echoed in Britain and elsewhere. And so there's a lot of resistance to the idea of being vaccinated, and even an early glimmer of the idea that it's an infringement on freedom. And this, of course, in a country that has just been through a revolution. So the interesting fact here is that after Napoleon is captured and sent into exile, the French government, after the restoration of the monarchy, actually reverses course and decides that for at least a generation that they're not going to pursue vaccination as a public health mandate, purely because this is a way of taking an anti-Napoleonic, post-Napoleonic turn and taking an approach that they deemed as more conservative and frankly more public friendly. And anti-vaccination movements spread throughout Europe and indeed in America in the 19th century, even as the British government, for example, was mandating vaccination for children under 3 months old in 1853, and then again in the 1880s for children up to age 14. The public was growing increasingly restive about this and fighting back against vaccination mandates on a number of fronts for reasons of health. Legitimately at that time, there were concerns about the safety of vaccinations. They're certainly not as safe as then as they are today, and people did have accidents, people did die, and there was concern about that. There was concern about offending people's religious tenets of their faith, and certainly concern about the dangers of, again, incorporating animal properties into your body, not to mention just issues of personal freedom. And all this culminated in a whopping anti-vax demonstration in Leicester, England in 1885. Lest we think that we have a strong anti-vax public movement today, this demonstration attracted 100,000 people in Leicester in 1885 and turned truly violent. So it gives you some sense of the feelings that were in the air with respect to vaccination, the ambivalent feelings, to put it mildly, at that time. And even intellectuals of the period, particularly intellectuals of the period, had something to say about vaccines and their dangers. George Bernard Shaw was on record as saying that vaccines were nothing but witchcraft. And the anti-vax movement had its counterparts in the United States. Again, multiple societies. This is just one I'm showing you, the Anti-Vaccination Society of America, but there were several others like it with millions of adherents who were concerned about safety, about infringement of their freedoms, personal freedoms, and concerns about what other toxins were being smuggled into their bodies by rapacious industrialists or quack doctors. And so there were a lot of the dialogue was seemed to us today vitriolic and ill-informed, but a lot of it was also raising legitimate concerns, certainly for the time. And then we carried the story forward on anti-vaccination to the present day, and a couple of events that really explain why we've seen a resurgence of the anti-vaccination sentiment even before COVID. And we can date this to some extent to 1973, when a British pediatrician, John Wilson, publishes some work suggesting that the pertussis vaccine, the whooping cough vaccine, actually causes neurological disorders of various kinds. Think particularly of the autism spectrum. And this idea gets currency very quickly in England, and within a few years, cases of whooping cough are up to 100,000 a year in the UK. And the idea becomes cemented in the American mind in 1982, when a journalist named Leah Thompson in Maryland goes live, local television station, with a report called DTP. So again, we're talking about the tripartite vaccine of which pertussis is a part. DTP, Vaccine Roulette. And the argument is made along similar lines as Wilson's, that vaccines are going to lead to a host, that there's proof that vaccines will lead to a host of neurological problems in children. And this argument persists, and it has only gained steam, as you're probably well aware, over the last few decades. And it goes a long way toward explaining these kinds of statistics. So here I'm showing you the trajectory for the incidence of pertussis whooping cough in the United States. And you can see that things look pretty good until we get into the 1990s and incidence starts to creep up, more anti-vax sentiment catching on, initially on both coasts and then in the interior of the country, until we get to the late 20-teens, and we've got a real problem on our hands again. Similar trajectory with the measles vaccine and cases of measles in the United States. The anti-vax movement begins to really get traction about 20 years ago, and by the late just a few years ago, you can see that there's a sharp spike in the number of cases in this country. So, what to do about all this? What I'm trying to illustrate here are a number of stories that we can tell the public, that historians, I think, are particularly qualified to tell the public about vaccination, stories that I think will engage them, but also share important lessons about issues we have to have in mind, concerns we need to address, questions that we need to answer if we're going to make progress on vaccines going forward. If we're going to get public buy-in that we need to increase investment and to encourage people to take up these new technologies for their benefit, then we need to find ways of reaching them with the information. And I believe, and we at the Science History Institute believe, that this kind of history, this kind of storytelling is a way of pulling in audiences that might otherwise not really be keen on quote unquote following the science as science. It's a way of pulling them into a scientific conversation that they might otherwise not be willing to have. And so we are now, I'm very pleased to say that at the Institute, we're part of a new project. This is a project called A Brief History of Vaccination. It is a series of digital exhibitions that is being curated by Google Arts and Culture. So Google has an arts and culture platform which they curate museum exhibitions. And this one is comprised of 18 organizations, including the Deutsches Museum in Germany, Science Museum London, and yours truly, the Science History Institute. We're one of the 18 organizations. And we are putting together a series of exhibitions to share some of the lessons, some of the historical anecdotes that I've been sharing with you today with the broad public in hopes of engaging them around questions of vaccination. And our contribution to this by our former fellow, of whom we're very proud, Rebecca Kaplan, is called Animals and the Making of Human Vaccines. And it is part of this larger 18 institution project of which there are now many digital exhibitions online. And I would just want to close by encouraging you to go to our website, www.sciencehistory.org/news. And if you go to that page, you can see a reference to our contribution to this History of Vaccination project. And if you go to that site, you'll find the others contributed by the other institutions. And this is our project, and we hope it resonates with the public. And I've enjoyed telling these stories, and I look forward to your questions.
So David, there are 1 or 2 questions that people are typing in. But before I read that, I have a question, but also have 2 questions. One is, I was talking to someone about the history of vaccines, and they said the following, and I wanted to know whether this is true, that actually Ben Franklin was a supporter of vaccines, and he had a young son, apparently, who he wanted to vaccinate, I guess either on measles or smallpox, and he just delayed because his son had a cold. And in that period where he delayed, the son got sick and died. And so he was a tragic personal story. Is there a truth to this? Someone
absolutely, it's absolutely true. The son, the child died at 4, I believe. I want to say it's in 1743. Don't hold me to that. The child died at 4, and he carried. I mean, Franklin in his old age said that was the biggest regret of his life. And he actually, it's not well, again, a story about the history of vaccination that is not well told. He wrote passionately on this subject for many years, a lot of letters, including during the time when he was in England, writing letters back to the United States about advances in what was at that time the variolation technique. And then, of course, in that, he's succeeded by Jefferson, who was absolutely on top of developments in the UK. A frequent correspondent with Edward Jenner, actually praised Edward Jenner, circulated his materials in the United States. So, and then of course, the story of George Washington, if we're going to complete the triumvirate here, is well known. The inoculation of his troops at Valley Forge against smallpox, which was a key factor in preserving the army during that terrible winter. So yes, the story about Franklin is absolutely true and quite tragic.
I have one question, and that is, you know, the for a long period, the drug companies retreated from the vaccine business. In fact, not until very recently, most of them had withdrawn, and only a handful of companies continued their research in vaccines and so forth. And now there's been a recent surge in interest now in an explosion of technologies. From a historical point of view, why did that happen? Do you know that why so many of them bailed out of the vaccine, business?
I mean, my understanding, I mean, there are a few explanations for it, I think, but one I've been told is that a lot of them simply found that it was a question of opportunity cost. So it wasn't so much that they couldn't make vaccines lucrative, they could, but a lot of the companies that were looking to deploy capital, particularly in the post-NSF NIH funding boom. So if you see that as accelerating in the 60s and 70s, and a lot of the findings from the basic research kind of coming out and cresting in the 70s, 80s, and 90s, a lot of the companies, I'm told, big pharma, that were deploying capital at that time, simply were seeing a lot of better places to put their money. It wasn't that they couldn't get a return on vaccines, but the return, the prospective return, perhaps was not as attractive. I think that was one big factor.
Yeah, and I think it's a little bit similar to the problem with antibiotics, in the sense that vaccines, if they're good, they actually it's like antibiotics. If you cure, the drug company doesn't make that much money, because after taking the antibiotics for 5 days, you're cured. You make a lot more money, and this is a bit cynical, you make a lot more money if you basically just prolong life rather than cure the disease. And I do think vaccines had one of that property, because some of the vaccines are so effective, they just wiped out the disease.
No, that's right, absolutely. And of course, now we're in a situation where companies like Moderna and Pfizer and others can look toward perhaps steady markets for their products for a long time, if we're even fortunate enough to move into an endemic phase. We expect these vaccines and their successors will be with us for a long time, so there's a more certain revenue stream. I also know that it's in the 80s and 90s and the early 2000s where companies start to become, big pharma becomes much more sensitive to demands on quarterly earnings, smoothing out earnings. And if you've got one-off kind of products, where, as you say, cured and done, you might get a big bump in revenue that can't be sustained. There's a move toward products that have a path towards steady income from a product for a decade or more. And so that was a factor, I think, as well.
Now, there's one question, I have part the answer myself, but will there be a vaccine to eliminate types of cancer? That's one question. Yeah,
so I'm not the scientist, but what I know is that I was just at a meeting in the Imagine Solutions conference down in Naples, where a number of people working on these problems were gathered, including some oncologists and folks like Bob Langer. And there was general discussion about this off to the sidelines of the conference. And I think the answer is yes. This is what we're hearing, is that this is one of the 3 or 4 most promising areas. And I don't think, a person like a Langer or a Phil Sharp would be prepared to say exactly when, but I think there's, cautious optimism that within a decade or so, there might be some interesting therapies to try.
Yeah. No,
a lot of investment. This is the single biggest area of vaccine investment right now. I know that the most capital, private capital, is going into that particular niche of the market.
Yeah, and I think what's very exciting about the vaccine technology is, first of all, so many different diseases have different mechanisms, right, for how they infect you and harm you. And so the vaccines, the technologies, there's been an explosion of different methods by which they can stop certain kinds of things. And that's what's exciting about it. I mean, it's not just, okay, you create antibodies and that's it, right? There are a lot of wonderful new technologies that have been worked on. There's one question from Dennis Voigt who says, you had the slide at the beginning about the funding of NIH. And his question is, what changed in 2004 that caused funding for NIH to stop increasingly dramatically and trending down?
So a lot of people have attributed to, I mean, I think in real terms, it started trending down. It was still, it still crept up a little bit in nominal terms, but a lot of people attribute it to the relationship between Congress and the White House during Bill Clinton's presidency. That it was during that time we had the contract with America, and discretionary spending starts to be something that goes on the chopping block, so to speak, to get to a balanced budget. And then you have the war, and people are looking for discretionary spending cuts in the early years of the George W. Bush administration. And frankly, a lot of people who had been, so you've got budget pressures, right? Operating budget pressures. At the same time that a lot of people who had been in Congress, particularly in the Senate, who had been champions of basic research in the golden age, right? In the 50s, 60s, 70s, the Fulbrights, the Moynahans, people like this. These people are rotating out, retiring, they're leaving Congress, and they're being replaced by people who frankly have a more populist bent. I mean, I'm painting with a broad brush there, but I think that had a lot to do with it. And we see the same thing with humanities funding, the arts, I mean, other kinds of education, other kinds of discretionary funding, I think have kind of trended down for a similar reason. They don't have those champions they used to have.
Yeah. There's one last question. There are one or two questions that are a bit off topic about, STEM and women, which is a very important topic, but, not the topic of this webcast. There's one question, which is a very interesting one, which is, do we have any further insight into a permanent flu vaccine versus rolling the dice each year and hoping you get the right vaccine design and out to most people?
I don't know the answer to whether we have the solution. I know that I'm going to blank on which company is working on that problem right now, has put the most money into that problem. And it might be, is it Merck? Perhaps Merck?
A number of people are working on this. A universal flu vaccine is
yeah, but really pump big money into it. But I'm not sure what the expected onboard date is for that. But you hear it discussed in terms that don't sound too Pollyannish. I mean, they sound like it could be reasonable in a short to medium term time frame.
Yeah, since I run an investment bank, that half of what we do is life sciences, and we have some really serious experts in our senior staff. I do know that there are quite a few efforts along these lines. And the bottom simple explanation is, viruses mutate, right? And they keep changing. And that's the problem, which is if your mechanism depends upon hitting a particular virus in its particular mutated form, you're going to have to keep guessing, right? So the key is whether they get to a point where they have vaccines that essentially don't care about the mutation, the kinds of things that mutate, and then they apply no matter what. But they're working very, very hard on this. I hope they're successful because, although the number of people who die from flu is a fraction of the people who've died from COVID-19, it's still a big number.
Interesting historical point on this too. I mean, obviously in the 19th century, people didn't know the mechanism for virus mutation, but they understood. I mean, some of the legitimate anti-vax sentiment in the 19th century was coming from people who were saying, hey, wait a minute, these vaccines aren't always protective forever. We were told by Dr. Jenner or whomever, these are going to protect you for a long time initially, but people had clued into the fact that that wasn't necessarily the case. And so they had legitimate concerns about why is this happening? Why is it effective? But then after a period of time, the effectiveness wanes. And so the point is that's a question that history tells us that people have been asking for a long time with some justification.
Yeah, we're running out of time, but I want to end with just my own personal observation. One of the most exciting things about being on the board of Science History Institute was that 20-minute segment when someone from your collections would come in and talk about a recent acquisition of a book or history and so forth. And it was a wonderful reminder of the richness of innovation and science over time, and also how we tend to, not remember where some of these inventions happened, and that in fact some of them, and your speech is a great example. Some, go back a long, long time, right? And like the Chinese may not have known exactly why their method 1,000 years ago worked, but it worked. And no one probably in this audience, I'm certainly one of them, would have known, except for your speech, that vaccines went back that far.
At least. And I think that this is sort of a summary point, is that if we accomplish nothing else as an historical institution, sharing out these stories of history with the public, it's that if we can get people to understand that the story isn't as simple as they think it was, that stories of origin and innovation were more complex. Innovations came from places they wouldn't have suspected, from people where they wouldn't have suspected, collaborative efforts, and not always linear progress. And I think if you can impart those lessons to the body public and engage people in science through the doorway of history, of storytelling, we stand a much better chance of having a more receptive public to whatever vaccine breakthroughs and technologies are coming down the pipe.
Yeah, I want to end by just encouraging all of you, if you haven't been to the Science History Institute headquarters and museum on Chestnut Street in Philadelphia, I strongly encourage you. It'll be well worth your trip. They have a wonderful museum where you just learn about all these unbelievable inventions, and they have great staff, and I recommend it. But I also want to say, David, I was actually paying attention to your slides, and I happened to notice, sadly, that the pamphlet and the headquarters of the Anti-Vaccination Society is on the same street that you currently have on Chestnut Street.
Irony of ironies, right?
Yes, well, so that's ironic.
So they were headquartered in New York, actually. That was a branch office, so we don't want to.
Oh, is that right? All right. Well, now I feel better. Well, thank you very much, David, for a fascinating speech. And I want to thank all of you in the audience for joining us. And we look forward to seeing you either on April 20th about coatings, or May 4th on lithium and the supply and demand related to electronic vehicles. So thank you very much. And again, thank you, David, for a wonderful, wonderful speech.